morning, everyone. Well, we are all aware that April 25th marks the World Malaria Day, and these special days are observed basically for the continued efforts to prevent the condition and also to empower the patients for their contribution in early diagnosis and prompt treatment. Now, today, here are we to learn about that how does it present and what are the differences from dengue. Dengue and malaria are these two tropical common infections which are mosquito-borne, and they can have very similar symptoms. Now, the patient can present with high-grade fever, body ache, headaches. These are all common symptoms. Then how to differentiate? In malaria, the fever is very classical. Chills can be seen in both malaria and dengue, but in malaria, a cyclical pattern is seen. Sometimes chills can be after 24 hours or 48 hours or up to 72 hours. Whereas in dengue, the fever is usually very high, constant with multiple chills in a day. So that is how we find out that yes, this could be a malarial fever. Then rash. Rash is very characteristic in dengue, whereas the rash is usually not seen in malaria. Then coming to jaundice. If the fever is very high, the dengue is very severe, then we'll have jaundice. Even malaria, if it is very severe on falciparum variety, then we'll have jaundice. Again, this would be more like a common feature. Then coming to bleeding. Bleeding is more characteristically seen in dengue rather than malaria. After the clinical features, we have to take the help of the lab tests in the form of the rapid diagnostic tests or even peripheral smear for microscopy to make a confirmed diagnosis. Now, the point here to learn is that if somebody has fever, high grade, with chills, do not sit at home, especially if the fever has lasted for more than 48 hours. Do consult your doctor. The patient has to be seen by the doctor, and doctor will examine clinically as well as will take the help of the lab tests to reach to the diagnosis. Thank you so much.